Hi everyone, my name is Brittany. So this is my presentation for Nursing 440, Vulnerable Populations Lucid Chart. So these past couple weeks we've been discussing vulnerable populations and how that can affect a person's health. So all countries have population subgroups that are more vulnerable to health threats than the general population. Vulnerable populations are more likely to develop health problems as a result of exposure to risk or have worse outcomes from those health problems in the population as a whole. So, the vulnerable populations that I will be discussing today include homelessness, poverty, mental illness, life in rural settings, migrant health, infectious diseases, addiction, and violence. So we can go ahead and start with poverty. So poverty can affect the health status of many people. Poverty has a direct effect on health and well-being across the lifespan. Poor person Poor persons have higher rates of chronic illness, higher infant morbidity and mortality, shorter life expectancy, and more complex health problems. And some of the causes of that is because of their lack of resources. We can move on to homelessness. So, homelessness, they are at an increased risk for adverse health problems due to resource availability. And then we can do so for mental illness, people who have mental illness are less likely to seek help because of the stigma that is kind of surrounded by mental illness. So they are less likely to seek help because they don't want to be judged because of that stigma. Low income and minority groups are often at an increased risk for mental illness because they lack access to services. Uh, preva- Prevalence rates for mental health problems are high, and people are at risk for threats to mental health at all ages across the lifespan. Another factor of vulnerability, life in rural settings. So, with life in rural settings, nearly 50% have been diagnosed with at least one major chronic condition. The health status of rural populations varies depending on the genetic, social, environmental, economic, and political factors of that area. So, rural adults 18 years and older are in poorer health than in their urban counterparts. Like I said earlier, nearly 50% have been diagnosed with one major chronic condition. And about 26% of rural families are below the poverty level. And then more than 40% of all rural children younger than 18 years of age live in poverty. So we can move to migrant health. So with migrant health, health problems are linked to work environments, limited access to health services, and lack of economic opportunities. So, migrant farm workers are faced with uncertainty regarding their work and housing, inadequate wages, unsafe working conditions, and lack of enforcement regarding legislation for field sanitation and safety regulations. So farm workers are also exposed to pesticides, and that's a chronic exposure that they have. Um, Yeah, so the barriers to rural health care include the lack of availability, like I stated, affordability, accessibility, and acceptability of services. So the next one, infectious diseases. So the emergence of these diseases are influenced by human activities and behavior. So with infectious diseases, preventing these diseases must be given a high priority in our healthcare system. Um, Healthcare professionals must constantly be aware of vulnerability to threats posed by emerging infectious diseases. Um, like I stated, most of these factors causing the emergence of these diseases are influenced by human activities and behavior. So, addiction. Substance abuse is the number one national health problem, and it is linked to numerous forms of morbidity and mortality. Drug addiction is often a family problem, not just an individual problem. Some of the high-risk groups include pregnant women, young people, older adults, IV drug users, and illicit drug users. And one of the primary preventions for substance abuse includes education about drugs and addiction, guidelines for use, as well as promotion of healthy alternatives to drug use, either for recreation or for stress relief. The next one is violence. So women are one of the populations that are at high risk for domestic violence. So factors such as history of sexual victimization, family dysfunction, substance abuse, and failure to use birth control can influence whether a young woman becomes pregnant. There's Violence can include domestic violence, sexual abuse. And the last one, homelessness. So, increased risk for adverse health related problems due to resource availability, just lack of shelter, lack of nutritious food. So, all of these vulnerable populations are interrelated. Poverty leads to homelessness. Homelessness, can lead to mental illness. Mental illness can sometimes lead to addiction and violence. It's just all kind of interconnected. Being homeless can lead to increase of infectious diseases because of the poor health and sanitation. Migrant health and rural health settings are both linked to poverty. And they can all lead to, mental illness as well. So some of the references that I use for my chart include the CDC and the World Health Organization. Thank you.